Welcome everyone to this CPG webinar for administrators. Today we will have the first of two general information sessions for the Episcopal Church Medical Trust's 2022 Group Health Plan Renewal and Annual Enrollment webinar series. Today's presenters are Akina Warner, Account Specialist with IBAMS, Anthony Coda, Assistant Vice President with Benefits Policy. Now you'll notice on the cover screen there is also Andrew Brown, who would have been the main presenter today, except for Andrew and his wife just had a baby. So he is off doing things that are more important to him and his family than this webinar. We are all very thrilled for Andrew. But Anthony knows this information in and out and has presented it before, and he will be presenting with Akina Warner. I also want to welcome Cecilia Roberts, and Stokes Lyles with IBAMS, who are assisting with today's webinar. You'll hear from Stokes later on for the Q&A period. Welcome Akina, Anthony, Stokes, and Cecilia. All right, Anthony, are you ready?
I am ready, and so, well, I'm gonna cut my camera off due to our little technical difficulty. So hello and goodbye. Yep, with Andrew out, you got the understudy, so let's work through this. First, thank you everyone for attending this important annual enrollment webinar. I believe this is our largest group ever for an annual enrollment webinar, so I'm really delighted for everyone's engagement and attention for such an important process. For those who don't know me, I've looked through the names and I know a lot of you, but again, my name is Anthony Coda. I lead the policy and design team within our benefits policy department at CPG. And as you can guess, we are responsible for the policy and designs of our health plans. For today's agenda, we will review the annual enrollment process that takes us up to and through annual enrollment, as well as the plan selection and annual enrollment timeline. I will then review plan design updates for 2022, including an important medical trust eligibility update, COVID-19 design updates and the impact to our benefit designs, and some slight changes to our Cigna dental plans. I'll then pass it to my colleague, Akina Warner, who will go through the 2022 annual enrollment communication campaign and then review the fantastic materials and resources that are created for both administrators and our members. And then lastly, we'll then have some time to answer some of your questions or respond to any comments that you may have. Next slide. Next. All right. This illustration, especially for some of you newer to this, and if you could continue, Bob, yeah, go through the transitions. This is just to situate ourselves with the seamless annual journey that we are on. And the goal of this journey is to provide the members of the medical trust with the appropriate benefits and enrollment. And this all starts from the planning to all the way through annual enrollment. As you can see, it starts with plan policy and design work. Then we move on to plan pricing. And then there's the last two segments of the journey, which many of you are familiar with. And this is the plan selections, where you select the health plans, and then through member annual enrollment. Next. All right, so let's take a deeper dive or a closer look into each one of these segments. The work that enables the medical trust to offer the quality benefits takes place over a year-long journey and moves from work within medical trust and CPG to partnering with our administrators, and then lastly through the annual enrollment process. The first milestone is work performed by my team in collaboration with both our internal and external partners. And we call this the plan array process. And we do this through the policy and design work. This is where we analyze our benefit plans to ensure that we are providing meaningful, valuable, and cost-effective benefits. During this phase, we benchmark our plans. And identify trends in the benefits industry. Bob, if you could go up, I think we're one slide too far. There we go. Thank you. And so I talked about the policy and design. The third bullet here, and I wish this bullet client feedback was bold and in flashing lights, because this part is really critical to the work we do. The feedback we receive from colleagues, administrators, church leaders, and members provide us with the insight we need to identify any gaps in our plan designs to ensure that our plans are appropriately designed for the needs of the evolving church. The next milestone in green on this journey moves from design to pricing. This pricing is the extensive process to set plan pricing or premiums for each of our groups for the coming year. The pricing process involves thorough assessment and collaboration between the medical trust financial analysts and our actuarial consultants. The team also extensively partners with our IBAMS account managers to help ensure that those establishing the pricing of your plans know about any specific local circumstances for each one of our groups. As a plug, the next annual enrollment webinar on August 17th will detail the pricing methodology as well as announce the national rate actions for 2022. Moving along, the next milestone, plan selection, concludes with each group selecting the plan or plans that will be offered to employees for the coming year. To tie it back to pricing, plan selection is when plan rates are introduced to the groups. All senior administrators, and Bob mentioned before, you know who you are, you will have the responsibility of making plan selections during this portion of the journey. The plans selected here are the plans that will be offered to employees during the final segment of the journey, annual enrollment. Annual enrollment milestone is reached when our individual members review and select their health plans for the next year. Even though we have passive enrollment, we do encourage all members to be actively engaged in their health benefits by checking their demographic details on record for accuracy, and also reviewing their plan enrollment selections and making any updates as needed. Next slide. All right. This slide may be a refresher, and many of you may have already seen this, but certainly for newer administrators, I find this to be a very helpful slide. This slide dives into the details of the journey I just talked about on the prior slide, and the focus on plan selections and annual enrollment. We start with what we call pre-annual enrollment work, which is from January through July. And thankfully, with only 3 days left, we are on target to complete this phase. Pre-annual enrollment consists of the plan array process I mentioned before. This is the bulk of the policy and design segments. We also look at new plan offerings and decide if we will be removing any plans from our array of offerings. Additionally, the vendors, the programs offered through our vendors are also evaluated to see if there will be any changes for the upcoming year. During this time, I mentioned before, the pricing and rate setting for the plan selections takes place. And then we get into the production of renewal supporting materials. This includes items such as annual enrollment guides, summaries of benefits and coverage, and plan comparison charts. During this phase, the review and completion of these are in full swing. Lastly, and Akina is going to get into this a little bit more, but we start the process for individual annual enrollment member communications. Through August and main annual enrollment for administrators, this is when plan selections for your group takes place. For this year, they will be released on MLPS on August 26th, and group plan selections can continue through October 1st. On the CPG end, this is where when our programmers prepare everything in MLPS for annual enrollment, so it's a seamless process. And next, annual enrollment member communication mailings. We start the mailings in late August. And like I mentioned before, Akina will go over more details in terms of the timing and what these communications are. After plan selections conclude, moving on to the purple in October, on October 1st, this is when in October annual enrollment starts. As we have done over the last several years, there will be 2 annual enrollment sessions for active employees. The first session will be from October 13th through November 3rd, and the second session October 27th through November 17th. Annual enrollment will be closed to members making plan selections on the last day of session 2, which is November 17th. I'll just mention for retiree annual enrollment, the dates are from October 15th through November 12th. For pre-65 retirees, I'm sorry, annual enrollment, that starts on October 27th through November 17th, and you could see that it follows the same timeline as active member annual enrollment. And again, that's for pre-65 retirees. During October as well, this is when we work with our vendors to ensure member account setup begins, and then after the close of annual enrollment on November 17th, that's when information starts being sent to our vendors through eligibility files. So everything, as I mentioned before, is set up so members can start using their benefits or continue using their benefits on January 1st. And lastly, in December through January, we call this our post-annual enrollment period. This is when CPG's client services team conducts a quality check of all transactions to ensure that our members are situated as they should be within our systems. And this is when we work with our vendors, and if appropriate, member ID card production and mailing takes place during this post-annual enrollment period. Next slide. Okay, and for education opportunities, we are holding, just like this one, there were 2 previous education opportunities in June, and those are posted on our ARC through cpg.org. Also, there are pre-recorded modules on ARC and in our AE Admin Central. These modules, they are new, and we'll talk a little bit more, but these are basically to learn about certain benefits at your own pace. So previously we would include this type of information in annual enrollment webinars, but we're pre-recording these modules, as I mentioned before, so you could do it at your own time, and we could focus on annual enrollment content through these sessions. But all this information is available on cpg.org. And as I mentioned, there will be 2 more general webinars regarding annual enrollment that occur through September. Next slide. Okay. Through this, you can see we're focusing mainly on active annual enrollment, but as an FYI, we are restating the retiree annual enrollment dates. I must mention that we are moving, for those of you who don't know, we are moving from our current Medicare supplement plans to group Medicare Advantage plans in 2022. Though this session will not go into these details, there is a recorded webinar from a few weeks ago available on ARC through cpg.org. Next slide. Next. All right. I'm going to go over the changes regarding our health plans that will be effective in 2022. First is centered around our eligibility for our active health plans. So in order to simplify our eligibility rules and to further support compliance within our plans, we decided to remove some complexity within our eligibility rules for the Episcopal Health Plan. We did this after gathering feedback from our clients, and the distinction between exempt and non-exempt employees was somewhat confusing, hard to track, and definitely hard to administer consistently across the church. So effective January 1st, 2022, we are removing the distinction between exempt and non-exempt employees. So what does this mean? This means employees will be eligible to enroll regardless of whether they are exempt or non-exempt employees, as long as they are normally scheduled to work 1,000 or more compensated hours per plan year. Keep in mind, some employers may elect to impose a higher hours threshold for employees to qualify for active health benefits. I also have to mention, and this is part of our administrator policy manual, which again, plugincpg.org is available there. Under our administrative policy manual, the participating group is responsible for confirming that members meet the plan's eligibility criteria. Therefore, if you have any employees working under 1,000 hours, you will be responsible for terminating their coverage 1/1/2022. Individuals who are currently enrolled but will now no longer qualify for coverage as a result of this change may elect to continue their health and/or dental plans for up to 36 months through the Medical Trust's Extension of Benefit program. Next slide. Okay. In terms of COVID-19 provisions, effective March 1st, 2020, the Medical Trust waived all copays, deductibles, and coinsurance for its members for any healthcare services related to the evaluation and testing for COVID-19. We also waived all copays, deductibles, and in-network coinsurance for healthcare services related to the treatment of COVID-19. These provisions will remain in effect through at least December 31st, 2022. So again, through 2022, the same benefits related to COVID-19 will be in play. Next, since the start of the pandemic and now through 2022, out-of-pocket costs for services received through telehealth platforms offered by Cigna, Anthem, or Kaiser, which uses a computer or mobile device, will continue to be waived. So again, there will be no copays or cost sharing if you use services through a vendor telehealth platform. And then lastly, prior to March 1st, 2020, so basically prior to the pandemic, virtual visits through any method available with a personal healthcare provider was always excluded from our health plan coverage, as was the industry's standard. As with many things, COVID-19 forced us to rethink this exclusion. So we removed from Medical Trust, Anthem, and Cigna health plans effective January 1st, 2022, and going forward, that exclusion, which means we will now continue to allow virtual visits. One thing to note, virtual visits are covered at the standard level of benefits and member cost shares. Whereas before I mentioned, if you go through the vendor and use their telehealth platform, that will be waived for 2022. In terms of dental, and to ensure that we maintain high quality and a comprehensive dental plan, we decided to do a review to work with Cigna Dental to modernize our offering through Cigna. First thing first, there will be no major changes to the dental plan. So we are not changing the annual maximum nor the plan's network for 2022. What will change is that starting January 1st, 2022, the dental plans will now include coverage for Exparel, which is a non-opioid pain management medication, mainly used for patients having oral surgery. So we're adding coverage for that medication. In addition, we are reclassifying certain oral surgeries and moving them to basic restorative service. This means that all of our Cigna dental plans will reimburse these services at a higher rate, which ultimately means less out-of-pocket costs for members starting in 2022. Next slide. In order for us to deliver our benefits at the high quality and the high efficiency to our members, we do partner with our vendors to ensure our administration and service to everyone remains high. With this, there are several changes I wanted to highlight for 2022. First, for Anthem, the platform for which they process claims and administer our plans will be changing in 2022. The impact the impact to members is that they will start receiving new explanation of benefits. These explanations will continue to provide the claim detail, the breakdown of the claims, any balances, and year-to-date summaries with deductibles and out-of-pocket spending, as well as periodic statements and more consumer-friendly language. Next, for all of our vendors, there will be enhanced cost transparency tools and resources as a result of the Consolidated Appropriation Act of 2021, which we expect to lead to more transparency on benefits and costs, more notices to our members, especially to prevent any surprise billing. And lastly, explanation of benefits for scheduled care in advance of an appointment in order to provide a good faith estimate on potential out-of-pocket costs an individual may have. With January 1st around the corner, our vendor management team has been working diligently with our health plan carriers to make these changes as regulations and guidance continue to be published. Next, as many of you know, we offer an employee assistance plan through Cigna EAP. We are excited that Cigna EAP now includes TalkSpace. For anyone not familiar, TalkSpace will expand our mental health benefits and access by providing a digital space for private and convenient mental health support. Our members can now regularly message a dedicated therapist via text, voice, or video, pretty much anywhere, anytime, and this is all through the Cigna EAP benefit. We always get asked a question regarding health plan ID cards and will there be new ID cards. One thing we could say for certain is with Anthem and the migration change I mentioned, the platform migration change I just mentioned, there will be a full reissuance of ID cards for Anthem members. Right now, our other vendors have not confirmed if they will issue new plan ID cards for 2022. But as always, and as general guidance, if you're ever asked, if an employee does receive a new ID card, they should begin using that new ID card and discard any older ID cards. I will now pass it off to Akina, and she will detail annual enrollment communications and planning. Akina?
All right. Thank you. Fantastic, Anthony. Okay, next slide, please, Bob. All right, so as this slide is building, this slide provides key dates to help you prepare for annual enrollment. So in addition to the renewal materials for our annual enrollment administrators on the webinar, we do have a couple of member-facing letters that are important for you to be aware of in case your members reach out to you. First up, the Dependent Aging Out mailing at the end of August. This provides early notice to those members and their impacted dependents that coverage will end on December 31st due to their reaching the plan's limiting age of 30 at the end of the calendar year. Next up, we have the Notice of Credible Coverage mailing on September 3rd. This goes to all members age 65 or older. This required notice confirms that their drug coverage is creditable, meaning comparable to Medicare prescription drug coverage. Members should retain this notice as they may need it if they decide to join a Medicare drug plan. As a reminder, for a copy of these mailings and any recent mailings or emails that go to your employees, you can go to cpg.org/ARC and navigate to the Documents and Mailing section. We'd also like to remind you about the key materials that are provided with the renewals package. We have the administrator letter templates. Now, these are customizable letters to support the annual enrollment administrator's communication efforts, especially for groups making any changes to their plan offering in 2022. Next, we have the plan comparison chart. This chart includes key benefit details for all plans offered by the medical trust. Annual enrollment administrators can reach out to your IBM's account manager to request a customized chart after the new plan rates are released on August 26th. Otherwise, a customized chart will be available to you and your employees on the annual enrollment member site once annual enrollment begins on October 13th for Session 1 or October 27th for Session 2. There's also the annual enrollment guide. This guide assists employees with making their annual plan elections. It contains key health benefit terminology, an overview of plan components, and things to consider when making annual enrollment decisions. It also includes vendor websites for locating providers. And the right-hand side of the slide displays the member annual enrollment session dates, as Anthony had walked through a little bit earlier as well. For annual enrollment administrators, your group's assigned session was shared by your IBAM's account manager, and you can reach out to your dedicated manager if you have any questions about that. If you are not an annual enrollment administrator, please reach out to your group or diocesan administrator for information. Next slide, please, Bob. Thank you. So this slide provides additional information to help you with planning. The active member AE timeline dates, annual enrollment timeline dates, are so important, we're including them on both planning slides. So first, plans going away. As a reminder, the medical trust is not discontinuing or sunsetting any plans for 2022. So that's great news. The same plan array that we've had in place for the last couple of years continues to be the array we offer to our clients. Medical Trust annual enrollment is passive for 2022. So in other words, if a member does not wish to change their coverage, they do not need to log on to the annual enrollment site. That being said, we always encourage members to check their demographic and dependent enrollment information, but otherwise, if there's no change to their desired enrollment, they do not need to make selections on the enrollment site, as we talked about earlier. Plans going away for 2022 only applies where the participating group elects to no longer offer a plan they do today. In that case, impacted members in a plan going away will need to actively make an AE annual enrollment election. If a member in a plan going away does not make a selection through the enrollment site during annual enrollment, they will not have coverage in 2022. So this is very important to note and worth repeating. If the participating group elects to no longer offer a plan that is currently part of their array in 2021, any members in that plan will need to pick a new coverage during annual enrollment, or else they will not have coverage in 2022. But fear not, annual enrollment administrators. As you might be aware, MLPS, the Medical and Life Participant System, has tools and reports available to help administrators manage annual enrollment, especially those in plans going away if the group so chooses. As always, please reach out to your IBM's account specialist if you need an MLPS refresher or help finding any of those reports. If members need help selecting a plan for the new year, the Health Advocate is available to assist them. And of course, the Health Advocate information is on our CPG website as well. We have resources available for any change a member may have through annual enrollment to ensure continuity of care, especially for those currently in treatment. These include transition of prior authorizations when moving from one health plan vendor to another. And there are also resources through the Health Advocate in selecting a benefit plan or help in finding a provider. The Medical Trust collaborates with our health vendors to ensure a successful transition, essentially ensuring everything is all set up and running for our members by 1/1/2022. Next slide, please, Bob. All right, so here is a look at our now signature annual enrollment mint green envelope. So members can look out for this envelope and brochure mailings as noted in the previous slides. Session 1 brochures are slated to be mailed on September 27th and Session 2 on October 13th. Again, you can find a generic copy of these mailings, once sent, on cpg.org/ARC. The brochure includes everything members need to know about annual enrollment from soup to nuts. So we'll talk in more detail about communications and member education in the next sections. Next slide, please, Bob. So there are lots of resources available to help you and your employees. This is a snapshot of the member annual enrollment page. The 2022 page update is currently in the works, but it will be available once annual enrollment begins on October 13th. Here is where employees can find materials, contacts, and resources to learn more about the plans or make a new election if they so choose. For a customized member benefit education session, annual enrollment administrators can reach out to their IBAMS account managers. We also strongly encourage our vendor websites and apps for resources. Next slide, please, Bob. So here's a look at the annual enrollment login page. Here's where members can log into the annual enrollment site or create an account if they do not have one in order to check on their personal data or change coverage if they choose. Next slide. And lastly, as we shared on the June webinar, and as Anthony shared earlier, we're excited to present this new feature intended to make life a little bit easier, we hope, for annual enrollment administrators. This central page is on cpg.org, and it's where we'll post health plan renewal and annual enrollment information such as news and updates, education opportunities, mailings, key dates, and other resources. This page is now available on cpg.org/AEadmin. That's cpg.org/AEADMIN. And of course, it's on the slide as well. So we currently have a new EAP learning module available. You can look forward to more learning modules and materials as we get closer to annual enrollment. Next slide, please, Bob. And with that, we will pass it over to Stokes Lyles for the Q&A portion. Stokes, over to you.
Hey there, thank you very much. Can you hear me? I think so. Thanks, Anthony and Akina, for your presentations. We're now going to open up the webinar for your comments and questions for discussion. There are two ways to ask questions or to make a comment. You can either ask a question using or comment using the questions window, which some of you have already done, and you just go to your GoToWebinar control panel, and I'll read those questions out loud in the order that they're sent to us. And you can also ask questions live. In the vertical bar to the left of you, should be to the left of you, the GoToWebinar control panel, you should see an icon that looks like a hand. This is the raise hand icon. By clicking this icon, we can see that you've raised your hand, and then I'll unmute you, or someone will unmute you, and you can say your name and state your question there. Does that sound all right? And let me just start with some written questions first. What is the definition of pre-65 retiree?
All right, I'll take that. Generally, pre-65 retiree, to be considered a pre-65 retiree, you need to be a member of a participating group in our Episcopal Health Plan, working at least 1,000 hours at the time of separation. You also must be age 55, at least age 55 or disabled at the time of separation. And if you're a lay employee, you need to have 5 years of continuous service. And if you're a cleric, you need to be vested in the clergy pension plan. The definition, we'll plug cpg.org, but if you do \APM, A as in A, P as in Peter, M as in Michael, then you could see all the full definition of a pre-65 retiree.
Thank you. The next question is, want to confirm that making eligibility consistent at 1,000 hours plus means retirees in exempt positions working less than 1,000 hours are no longer eligible, so can stay on Medicare with the supplement, soon to be Advantage plan, and not have to do MSPC processes, correct?
That is confirmed. That's part of the reason I mentioned with the compliance component of it. This will certainly help with compliance, especially for those returning to work from a retired status enrolled in a Medicare supplement, as you mentioned, soon to be GMA plan. So in those situations, they can stay on the Medicare, or starting 1/1/2022, they can stay on a Medicare group of Medicare Advantage plan and also receive the subsidy towards it.
Mm-hmm. And Lauren, we have noted your hooray, so thank you for that. The next question comes from our old buddy Matthew Payne again, and if we have someone currently on MSPC that wouldn't be eligible come 1/1/2022, how will they transition back to the Medicare and Advantage plan?
I would say, I mean, it would follow us, I would say let's follow the same process we would now if they became ineligible. So going about terminating their coverage. But this is something I could bring back to the Medicare Advantage team to see if there's a way to further support, because we would want them certainly to get group Medicare Advantage materials, enrollment materials and everything. So I'll definitely take that back to the team, but I would think the process would be very similar in, working with our client services team. But I think it's a great point to bring up. I'm thinking more from like kind of the marketing and plan design, so they're aware of the group Medicare Advantage and that they could get those materials prior to 1/1/2022.
Thank you. We're going to switch over to a live question now. Brian Ponder, I tip my tiny hat to you, sir, and go ahead for your question.
Hey, can you hear me?
We can, yes.
Great. And this is really kind of off topic for annual enrollment. This is more of a policy question. And so if it's inappropriately asked here, if y'all could just kind of follow up. I'm wondering if medical plans in 2022 will follow new guidelines on colon cancer screenings at age 45 instead of 50. And I don't mean to take us off topic. So, if you can just tag that for another time too, that would be helpful.
We'll follow up with you, Brian, on that. But we just generally, our medical policies are driven by our vendors. So we'll definitely follow up with that.
All right. Thanks so much.
You got it.
Thanks, Brian. And we have one more. I skipped over one question. Sorry, Tracy. What is the age for a dependent to age out?
Well, for this year, they would have to be it's every year, age 30. So if someone's age 30 by December 31st of this year, then they age out of the plan. So that would be the mailing that Akina mentioned before.
Okay. Another question. Let's see. Thank you for the edits to language of exempt within the eligibility. That is huge for us. Grateful that you have heard the feedback and made the changes as a comment. Here's another question from Sarah Fisher. We are preparing our 2020 budget now. Is there a way to estimate the 2020, we are preparing our 2022 budgets now. Is there a way to estimate the 2022 costs based on current pricing?
I going to have to plug I hate to do this, but we're still in the process of finalizing pricing. So again, plug in the August 17th webinar. That's where that will be released. But again, it's not finalized yet. So I wouldn't want to misinform anyone on that.
Okay. Next question. Someone mentioned voluntary coverage for those with less than 1,500 hours per year. Can you repeat that information, please?
Regarding the DHP, I believe that's the DHP requirement. So the DHP, in order to be mandatory coverage under the DHP, the YAWA threshold is 1,500 hours. So I'm not sure I understand the question or what else is needed. Is there any follow-up?
If you can, yeah, if you could put that follow-up in the question, that would be great. And here's a great one. I'm going to give this to Akeen. I could answer part of this, but I'd mess it up. Thank you for all the info. Can you clarify what is IBAMS and MLPS? Akeen, take
Yes.
the first part of that.
Absolutely. Thanks, Stokes. So IBAMS is the Integrated Benefits Account Services Management Services Team. And MLPS is the Medical and Life Participant System.
I always mess up the name of my own team, and I've been with it for quite some time. Anthony, could you define DHP, please?
Yes, that's the denominational health plan that requires individuals working 1,500 hours to participate in the Episcopal Church health plan. That's certainly the Cliff Notes version of it, but but that's generally the direction brought about by General Convention.
Let's see. I think I've got all of the questions from that. Let me see if there are any more raised hands. If you're going to raise your hand, now is the time to do it. I don't see any raised hands. And I believe that does it for the written in questions as well.
We've got one more, Stokes.
Oh, I see. At the very bottom. Sorry. Please clarify. I am confused about the minimum number of hours required to be covered by the health plan. Is it 1,000 or 1,500 hours?
The minimum hours are 1,000 under the health plan.
Thank you.
So then, Anthony, the 1,500 relates to what?
The denominational health plan. What I'll do is I'll pull up the actual definition regarding the DHP and maybe post it in the chat. So for those not familiar, they could see it there.
Okay.
One more question. So we are required to provide health coverage by DHP for 1,500 hours, but you allow those with 1,000 hours to receive coverage.
Correct. And then there's cost sharing provisions related to the DHP. So it gets into more detail. So what I'll do is I'll put the link to cpg.org in the chat right now, and really everything, including the actual resolutions, are posted there. Okay.
Let's see. Yeah, they had a couple of comments there. I think that's it for the questions, folks. I see none. Let me check the raised hands one more time. No other raised hands. Bob, should I give it back over to you, sir?
You can most definitely do that, Stokes. And I want to thank you, Stokes, Anthony, Akina, for the information that you presented and for taking care of the questions and answers. If you continue to have questions, we encourage you to contact your IBAMS account manager. If you are an administrator and you don't know what an IBAMS account manager is, we encourage you to contact your diocesan or group administrator, your annual enrollment administrator, and you can call CPG's client services for assistance too. When you leave this webinar, you're going to get a pop-up. It's going to ask you to take a very quick survey. We ask you to complete that. It's 4 questions, that's it. We do take seriously your comments to us, and we change as a result. So please give us your feedback. Once again, thank you all for attending. We know that your time is valuable. And we hope that from this webinar, you've received a lot of good information related to your management of your group's annual enrollment process. Once again, thank you, everyone. Look for the follow-up email from GoToWebinar. It will give you a link to the CPG Administrator Resource Center webinar page. And as of right now, this concludes the webinar. Thank you, everyone. Have a good rest of the day.
Thanks, everyone. Thanks, Bob. Thanks, Anthony.